Hello, my name is Brian Casey. I'm editor-in-chief of AmpMini.com, and we're here at the 2013 edition of the Radiological Society of North America meeting in Chicago. We have with us today Dr. Lawrence Muroff. He is president and CEO of Imaging Consultants and also clinical professor at the University of Florida and the University of South Florida. Dr. Muroff, thank you for being with us today.
Delighted to be here, Brian.
So, Dr. Muroff, you were at a Sunday session that talked about the impact of healthcare reform on radiology. What were some of the things that you discussed there?
Well, it was a two faculty member session, Brian. The first faculty member was Dr. Bernard King of Mayo Clinic, and he laid the foundation by talking about the evolution of healthcare reform all the way from the beginning of Medicare. And then I talked about trends that radiology is facing today and some of the strategies that people might employ to meet those challenges or to take advantage of the opportunities. And basically, there are several things that are happening now. Some things will evolve more fully over the next several years, but certainly we're seeing declining reimbursement as a major trend. Then we're also seeing a shift in Washington's focus, or certainly a more focused concern for family practice, perhaps at the expense of subspecialty or specialty expertise. We're seeing more demands from hospital administrators, and those demands center around greater control of the radiology groups that serve those hospitals. Those demands in many ways are meritorious for the patient. They include demands for subspecialization, for increased hours of on-site coverage, for greater numbers of subspecialists, and in general for aligning the goals of the group's radiology practices with those of the hospitals. The next trend we're seeing is basically the non-traditional competition from national entrepreneurial radiology companies and basically companies that are aggressively pursuing, for a variety of reasons, hospital contracts. And then finally, the last trend I talked about centered around the evolution of alternative payment systems and the need for radiologists to understand that there's got to be a shift from output to outcomes. In other words, we'll be paid on keeping populations healthy or getting them healthier faster, and from volume to value. Basically, under fee for service, we get paid for what we do, and the more we do, the more we get paid. Under newer or alternative payment systems, we're going to get paid for basically providing value to the system. And these are major changes and major opportunities for radiology practices.
No, we know all about the challenges that practices are facing. What are some of the opportunities? How can practices, take some of these lemons and make lemonade
Well,
out
I
of it?
think that some radiology groups, whenever there's change, there's opportunity, and that's been the case in any sector of the population ever since I've been aware of business entities and opportunities. So things are changing, and those people that change with or the evolution of newer trends in medicine and in radiology will prosper. The problem is they're going to prosper often at the expense of their less knowledgeable or less willing to change colleagues. But there are going to be opportunities, I think, to help build alternative delivery systems, to participate effectively, to take the lead. There are going to be co-management opportunities with hospital systems to take charge of maybe 7, 8, or 10 hospitals, all controlled by one system, and forging those various radiology entities into one cohesive entity. And somebody's going to do that, somebody's going to prosper.
So radiology is going to look different, but it's not necessarily a bad thing.
I think radiology is a great thing, and I think if there's one message that people such as I or publications such as yours, respected and very well read entities such as yours can drive home it's the message to young people that they've made the right choice by going into radiology. It's intellectually challenging and satisfying. I mean, things are changing all the time. It's financially rewarding despite the great number of reimbursement cuts, and the quality of life is difficult to beat. So it's a win-win-win situation. And young people who question whether they've made a mistake by going into radiology, I think, need to understand it's the place to be in medicine.
All right, perfect. Well, those are great words of encouragement.
Well, thank you very much, and thank you for inviting me.
Great. Thank you very much. Signing off for AntMini.com, my name is Brian Casey.